back on their it's a time for them to look back on their experiences in medical school and give feedback. And then it's nationally aggregated. And so they define mistreatment on that graduation questionnaire that the students are reading as either intentional or unintentional. It occurs when behavior shows disrespect for the dignity of others and unreasonably interferes with the learning process. They give some examples of mistreatment, which are pretty obvious: sexual harassment, discrimination or harassment based on race, religion, ethnicity, gender, sexual orientation, humiliation, psychological or physical punishment. And they added this last part in around 2009. They added this to their definition, which was the use of grading and other forms of assessment in a punitive manner. So this is associated with our medical students and our residents where there's a power imbalance. And when they feel like assessment or grading is being used as a form of retaliation for some of their behavior in the clinical learning environment. We can go to the next slide. Here is that in the medical context, he says he would consider extending this to the misuse of power in a gendered or sexual way in a setting of power imbalance. This is really important in medicine because of the hierarchy that is often necessary on teams and also in the training context. So when there is a power imbalance or a misuse of power based on gender, we would consider this sexual harassment. And next slide. So this is an article in JAMA from 2017, looking at that graduation questionnaire that I alluded to before. So this was 405 US medical students in the Doctor of Medicine courses. And on that graduation questionnaire in 2017, 33% of students, so a third of students reported personally experiencing sexist, racist, or other offensive comments, lower grades, or denial of training or awards based on sex, gender identity, sexual orientation, race, or ethnicity. And that, importantly, reports of sexual harassment have stayed stable. They've stayed the same since 2013. So we've had a lot of initiatives on sexual harassment and mistreatment. And despite these initiatives, we still see that number remaining the same on the graduation questionnaire of students being recipients of this behavior from either classmates, residents, or attendings. You can go to the next slide.
Thank you, Dr. Piamonte. So this is such an important topic for our Creighton community. And I was actually very fortunate. Recently, I was in a workshop on microaggression, and I got to hear Dr. Ackerman speak. And she also shared her publication in our toolkit. So our goal is to use this tool to see how we can address at Creighton and CHI. So if you heard this paper, the Microaggression Triangle model, a humanistic approach to navigating microaggression in health professional schools. The triangle model includes recipient, source, and a bystander approach. In a humanistic way, how do we, when we address microaggression, understand each other instead of calling you did this, he did this, versus putting us in each other's shoes to understand where each person is coming from. You know, it's also really important to know the recipient sometimes can be the source. I myself would have probably done a lot of microaggressions and also been the recipient of microaggression. So we all have a lot of unconscious biases. So all of us need to learn these tools so we understand each other and, you know, we help each other grow in the Creighton community. And with these three pillars, she talks about restorative justice model, where rebuilding and giving each of the individual the opportunity to build their relationship and reputation is really important. Because, you know, just because there was a microaggression that happened, you're not going to talk to that person going forward. So it's really important to rebuild that relationship in a way that you could continue to work with each other and be colleagues and peers and students. So she gives some tools. What do we do as a recipient? So if I am the recipient, what are some of the questions at that moment, or how can I address it at that moment? It's really important, like Dr. Piamonte said, if there's a power dynamics, if you're a student, and you're with an attending, sometimes as a recipient, you cannot respond because there is a power differential. But if you feel comfortable and you think you could address it at the moment, there are some ways to discuss it with the source, asking for clarifying questions. What did you mean by that? So come from an area of curiosity. I want to understand better. What did you mean by that? Tell what you observed. I noticed this is what just happened. Is that what you meant to do? Also, it's also sometimes okay to use humor. So impact exploration. Ouch, did you mean to say that? Is that what I just heard? So you kind of make that situation a little bit easier, but you're still addressing it with a little bit of humor, but getting to the point. Own your own thoughts. So you could say, I really, this is how I felt at this moment. I know you didn't mean to do it this way, but this is how I felt. Can we discuss it further? And then also ask, next step, can we continue to discuss this? Or we could have more conversations regarding this as well. So leave that open so you continue to have conversations. Again, this is easy to say but hard to do. So we all have practice, lots of practice, and get comfortable with how to address these situations and scenarios. As a source, it's really important. We all have a lot of unconscious biases. So it's really important to acknowledge our biases and seek feedback. I noticed when I was just ask for feedback, say thank you for giving me feedback. This helps me grow as a person. Although this was not my intention, you could say, I see how it hurt and harmed you by my actions and my word. So I think as a source, it's really important to apologize and ask for feedback and say sorry. But sometimes as a source, we might not even realize we have just had a microaggression event, a scenario. So we have to be open to really saying, yeah, I just got the feedback. Wow, I need to apologize and move forward. And how do I restore and repair the relationship? Bystanders are really important. And this is really important when you have power dynamics. If you see a medical student and there's two attending and the other attending can be the bystander and see what's happening and intervene and help, clarify some of the situation. So you're helping the recipient. Awareness, respond with empathy, but not judgment toward the source. Inquiry, did you mean to say it that way? Can you explain it a little bit more? Statements with I. When that happened, I saw Rick was upset, and did you mean to do it that way? Educate and engage. When this happened, as your friend, you might not have seen it, but this is how Rick felt. How can I help you? Can we discuss this further? I think it's important as a bystander to create those dialogues as well. So there's really nice acronyms. They are used for recipient, its actions, source assist, and for bystander arise. So these are some of the tools when we have scenarios and we're going to try to use these tools in the follow-up scenarios. Dr. Johnson?
You're muted, Ron.
That's why I should never be in charge of handling anything here. Now, the format now is that we're going to present the scenarios, and then there will be a participant who will be responding to identify whether or not it is or is not a microaggression, and then there will be panelists presenting on how they would handle these situations. We have scenario number one.
All right. So you are walking through the nurse station and you run into a senior resident who is female and an attending who is male, who are working at the computer station. You greet them in a friendly manner and ask how the attending is doing. He replies, "I'm doing great. I'm lucky to have such a beautiful resident on my service. Isn't she beautiful?" The resident looks embarrassed, but laughs it off and keeps working.
So, Dr. McKillop, the question is going to be, would you consider the attendees' comments to be sexual harassment?
You know, it took me a long time as a physician to name this and recognize it for myself, that this is harassment. It's so pervasive and common, and is apologized for and said, oh, this is just how he is, that I think the cognitive load as the recipient of hearing something like this is significant. And if I name it as sexual harassment, then I'm the victim of sexual harassment and I have to deal with that on top of everything else that I'm dealing with. And it's easier to just dismiss it and try and ignore what just happened. But yes, it is. And to be able to say to yourself, I belong in medicine. I belong here. This doesn't reflect on me. It reflects on the source.
Thank you. What are some of the recipient actions in this situation? Dr. V?
Yeah, this is a good question. It's really hard because, there's a big power dynamics. You have a resident and then you have an attending. You're in a nurse's station, so people are all around you most likely. So how do you respond to this? But I think it's important if the resident feel comfortable addressing this at this moment, starting even with humor. Ouch, did you really mean to say that? I was looking forward to working with you this next month with my skills and talents. What did you mean by that, right? Or something along those lines where you're doing an ouch statement, telling their source about your skills and what you were looking forward to doing this next month in the rotation. But again, this is a really difficult situation. And sometimes the recipient might not be able to talk to the source. Another way is, Dr. So-and-so, when you said that, it made me feel this way. You might have not meant to say it that way, but this is how I felt. And would you like to discuss further? So you're being vulnerable and you're sharing how you felt, and leaving the dialogue to be open so you could continue to discuss. Again, some scenarios, it cannot always be the recipient addressing the situation. It has to be others. Another option is the recipient going and talking to a program director, and then, or somebody in leadership as a bystander, then reaching out to the source to address the situation as well. Hope that. Any other input on that question from the panelist?
I would say that you're right, Dr. And sorry, I don't know where that echo is coming from, that this is really difficult for the recipient. And I wonder if this is one of those situations where the bystander is kind of the critical person here.
Yeah, agree. I think the power dynamics here is so different. Big. I think bystander will be the appropriate, but if you do feel comfortable, again, we want to create a culture of Creighton where everybody wants to listen and understand each other, but we're going to take some time to work on these tools.
That's a great segue into our next part of this. how can a bystander arise be used in this situation? Dr. Sharma?
Yeah. Well, bystander has a significant role here, especially when there is power differential, right? And as Kate was mentioning, we've been at recipient end. I've also been a bystander. And I will tell you that it's taken me a while to stand up as bystander, because these situations are uncomfortable for recipient and for bystanders. It's embarrassing to witness something like this. But at any rate, for bystanders, inaction is not an option. That's what I would say, because you bring the power here. Whether there is a power differential or not, you are not the person who is at the receiving end, and hence it's possible that you're more in control of your emotions. So how could a bystander help? Bystander could be an ally to the recipient. Bystander could be really an upstander. So how so? Depending upon the situation, a bystander can choose to address this situation first with the source. Go right to the source. And let's see how we can use this ARISE model to address the situation as bystanders. So first thing is bringing awareness. Call it out. Say what it is, what you heard. And you can simply say, are you for real? Did you just say that? I'm surprised you said that. Something like this. Again, how you respond and how you bring awareness would depend on your relationship with the source or perpetrator, right? This is one way of bringing it to their attention. Then, respond and inquire. Bring non-judgment. You can ask a clarifying question. Be curious. You can say, could you explain what you really meant by this statement? I want to understand your thinking behind this process or this statement that you just made. When you come with curiosity, you disarm the source. Because as we all know, and I can say from experience of many that I know, most of us have experienced things like this, unfortunately. And the source can, when you're calling it out to the source can become very defensive. So it's important to show some empathy here. I know it's hard to bring empathy in situations like this, but if you can show some empathy or just bring in some curiosity, that helps the source to let their guard down. They'll be more willing to listen. They will be more receptive to your question and the situation. So calling it out, make it known what just happened. Inquire, and then state the impact. State the impact that it had on you. So in this situation, for example, I would say, I was really embarrassed to hear this. And I saw that the resident was also embarrassed, but she continued to work. You made it sound like she's an object. You made it sound like she's more valued for her appearance than for her skills. This doesn't sound right. So that would be one way you would highlight the impact of the situation. You're kind of siding and supporting the source by taking this, making this statement of the impact it has on you. And then we have to be direct. So the next step would be to educate. And source may or may not know that they have, created this situation. It's good to be direct with the source and let them know your comments are inappropriate and are not acceptable and unprofessional. Your comments are categorized as sexual harassment. So say it, name it, so that it can come out in the open. and it's not remaining in the background. So this would be addressing with the source. Bystanders can be of real help and ally to the recipient. Depending upon the situation, you can show some compassion, talk to the recipient and say, hey, this wasn't right. You can share your experience and say, this happened to me and this is how I handled it. You can also reaffirm and say that it has nothing to do with your ability as a physician. You are a very capable physician. And, just again, provide the support to the recipient as best as you can. This is your obligation, in fact, especially when there is power differential. As leaders, people are looking up to us to address these situations. And again, inaction is not an option. We cannot be quiet in this situation. As to the timing of when you do that, it depends. It depends on the situation. In my experience, if we leave it to the default, like not addressing it is not an option. If emotions are running high, you can leave it for a few hours, maybe address it next day, but it has to be addressed. And the third responsibility bystander has is to the organization. If they are in a position to address it, I would say we all need to find the power within us to address these matters, regardless of whether we are a resident or we are at the top of chain of command. Address it with the organization, approach the leaders, and let them know what you witnessed. Again, depending upon your relationship with the source and the recipient, this could be something you would want to discuss with them before. These situations are very sensitive. It's very important to comfort the recipient and make sure that they are okay with this step. You can even empower them and say, I ask you to not, bury it under the rug and let it out be in the open. You don't have to name people while bringing up to the leadership, but bring it out. Let them know what happened so that the leaders are aware what is happening in their organization, and then they can take some steps to mitigate it. I would like to hear other comments.
Thank you, Dr. Sharma. So our next question related to this is, how can the source reflect on this or assist in the situation? Dr. Pamante?
Yeah, so I hope to also address some of these really great comments and questions that are in the chat. So thank you for those. I suppose I do want to start out on that point of what if the attending was female? Would it be okay in that context? So the article from which we have been drawing on, and I hope we can share that with the audience, it's a really great article. The point of the microaggression is the impact of it. And if it causes some kind of cognitive load, which is what Dr. McKillop was referring to. So even if the attending was female and I received that kind of microaggression, if it caused me to think like, what did she mean by that? Or does she think that my looks are the only things that matter? That cognitive load of the resident having to even ask herself those questions, the authors would say is a microaggression because she's now spending time doing that rather than thinking about patient care. So perhaps the gender of the attending matters and perhaps it doesn't. What matters is the impact or effect that the comment has. I think more of us would be likely to consider it sexual harassment if we saw it as a male-female power dynamic, but that's not to say that it coming from a female attending would not result in a microaggression. So one other thing to consider here when we think about how the source should respond. So it's really, I think most sources, like we have this comment in the chat of, well, what if he thought he was just giving a compliment? What if the bystanders think he was just giving a compliment? It's very easy to get defensive and be like, why are you all offended? I was just complimenting her, right? So the hope is that someone who calls it out to the attending in this instance does so with empathy. I know you thought that you were giving her a compliment, but now she's probably thinking about what you mean by that. And, let's not distract her when she's trying to take care of patients. So the source really has to kind of step into some humility, which is really hard, relinquish some of that defensiveness, which is really tempting, and say, okay, I guess I didn't mean it that way, but if it did have this impact, if it did have this effect, I'm willing to listen and reflect on my behavior moving forward. That is the hope of this model that is focused on repairing relationships. The point is the attending is probably going to be working with this resident in the future. The point is to repair the relationship. And part of those reparations involve humility, reflecting like, okay, I guess I had that effect, even though I didn't intend it, and then apologizing. That's what we hope we would see from the source in this situation.
Thank you. We've got another scenario that we want to share.
I will go to the other scenario.
Yes. Dr. Sharma.
All right, scenario 2. A friend of
No,
yours.
scenario 4, I think.
Oh, well.
Okay, I'm sorry. You're right. It's called 2, but we renamed it. Okay, good. I'm sorry. Go ahead.
Doesn't matter the number. We have the scenario.
Oh, good.
A friend of yours is a surgery resident who tells you about a recent experience she found offensive and uncomfortable. She was assisting a female attending in the OR and attempting to maneuver the patient into a different position on the table when her attending told her that she was too weak and skinny to even try to do that, and asked the tech in the room to move the patient instead. Your friend was surprised that this comment came from a female surgeon and thought the remark was unprofessional and inappropriate.
So, Dr. Sharma, do you agree that your friend should feel offended by this experience?
Absolutely. This is inappropriate and unprofessional. It has significant negative impact on the resident. Imagine the resident being there in the OR setting with so many other people around her. It made her feel less than capable, inadequate, excluded.
Thank
So
you.
I would say this is not an appropriate statement.
Thank you. Would you consider the attending's comments gender bias, Dr. V?
Yes, this is an example where you have gender bias from female to female, where a female attending is telling a female resident she's not able to move and she's skinny and too weak. So yes, it's definitely gender biased in this example.
Thank you. What are some of the recipient actions in this situation, Dr. McKillop?
I think that the first question she should ask herself is, am I safe to respond right now? What's my own gut check? How am I right now? I came across a wonderful quote from Viktor Frankl recently that said, between stimulus and response, there is a space. And in that space lies our power to choose. And in our choice lies our growth and our freedom. And so I think recognizing that this was a stimulus, I am enough, I belong here, am I safe to respond right now, should be her first question. And maybe the answer is no. Maybe she does a great job and knocks it out of the park with this case and goes to a trusted mentor later and talks it over and says, how should I respond now? I think that the mnemonic action is a useful one when we feel empowered as the recipient to respond in the moment. But I think affirming ourselves before we go through the emotional labor of fixing the situation as the recipient is an important first step. The
Thank you.
action mnemonic, oh, I'm going to pause responses to that.
I'm sorry. Did you have something else you wanted to add? I'm sorry.
Yeah, I think that asking a clarifying question, that A of the action mnemonic can be helpful here. The come from curiosity, not judgment. Those are all useful strategies, and I would encourage everybody in our Creighton community to review this excellent paper and to just generate some practice phrases that we can have at our disposal when we're the recipients of a discriminatory statement, but to own that it's not on us to fix it in the situation at the moment.
Thank you. How can the bystander arise be used in this situation, Dr. Pamante?
Thank you. I want to mention first that I hope that we can get to Dr. Bittner's question at the end of this session. That's what happens when some of these comments come from a patient to one of the residents or trainees. And I think that folks on this panel have had that experience, and we can speak to that. Also, the important point of retaliation that I see in the chat, which can maybe be addressed by this bystander response. I think that's a real concern. It's a real concern among my students, definitely. And while we have policies that say retaliation cannot happen, it is still a legitimate concern when power dynamics are at play. I think that's why it's important to have allies that are also higher up in the institution so that they could have those conversations, maybe on behalf of those with less power, more as colleague to colleague, higher up in the ladder than someone who feels that they are at a power differential. But we should acknowledge that retaliation is a real legitimate fear that many people have, and an excellent point for us to consider. In this situation as a bystander, so if I am the resident's friend, the first part of the acronym is to have awareness and be attuned. So hopefully as a friend, I'm already attuned to the fact that this was an unprofessional and problematic statement from the attending surgeon, okay? But the next step would be for me to affirm my friend. You're right that this does not feel right and that this was unprofessional. And you might ask her, if you're uncomfortable going to the PD, like I encourage you to go to the PD and talk about this to your program director. If you're uncomfortable, I'm willing to go with you, or I can go for you, if that's what you would prefer. So asking her what the next best step is and being an ally and supporting that. Let's say I were to go to the program director and I articulate that this is an issue. Let's say the program director agrees with me that it's an issue. The program director would then go talk to the faculty person. That's what I mean about letting someone maybe higher up have that conversation on your behalf. If the PD were to have this conversation with the surgery attending, there are some points that a bystander, now the PD is a bystander, okay? And here are some things the PD can do. One is to use I statements. So I get the sense that our resident was offended when you said that. I think I would be offended too. Can we talk about it? So those I statements are important. Another really important point that's brought up in the paper is to create a discrepancy for the attending surgeon. The discrepancy is between what you know that surgeon values, that they want to be a good educator, that they want to help cultivate residents who become competent surgeons. That's what they value, but the behavior was inconsistent with that value. So the PD might say to the attending, I know you didn't mean to do that, and you want to create the best residents possible. But when you say things like that, that resident shuts down instead of being present in the surgery to learn from you. The best way to get your residents to learn most effectively is to create an environment where they don't shut down because of those comments. And sometimes using that discrepancy can really help the source understand their problematic behavior.
Thank you. How can the source reflect and assist in this situation, Dr. V?
Yeah, this is really important as well. So I think for the last scenario, what Dr. Piamonte said about you have to not be defensive You really have to be open to getting feedback. It's easy to say, but it's going to be really important for lots of different scenarios. We have to be open to getting feedback. And if the source gets the feedback from the recipient or the bystander, depending on the situation, who's able to give the feedback, I think it's really important for the source to acknowledge their unconscious bias or their actions and say they are sorry. It's really important to say they're sorry and also to say the impact that made on the recipient. This was not my intent, but I see how I have harmed you by my actions or my word, and I'm really sorry. Sometimes it's really hard to say sorry because you feel like you did you're wrong and you're defensive, but it's okay to say sorry. And I think that's going to be really important. Again, I think I would love the panelist input on this too. It's going to take the source some time to reflect some time to get to that point as well. I think when a bystander or a recipient gives these feedback, it might take them sometimes as a source to like decompress and go, oh, wow, what I did, and this is how the recipient took this. I need to now repair the relationship. So it might not happen immediately, but it'll take some time to reflect and then be able to repair those relationships as a source.
Thank you, Dr. Thank you, Dr. B. Am I talking like Darth Vader here now, or I can hear an echo, but can we go to the next slide, please? I think we're transitioning, I'm sorry, to the chat room questions that came up. I wanted to just very quickly, because I have to unfortunately leave here, but one of the questions was raised by Dr. Bittner about what would you do in the event that something like this was occurring with patient and the patient makes an unwanted comment that you view to be a microaggression. There are a couple of things that could be said in this situation, because you're certainly caught off guard by these when they occur, but I'm here to be your doctor and provide your care. Or the other thing you could say is, I don't know whatever they said, blank, you fill in the blank, has to do with your care as a response to those situations. I'm also reminded of the fact that maybe in terms of the future of these events, that we might want to think about having a more interactive situation where people can practice some of these responses, because they're not something that we kind of spontaneously come up with, but I think that certainly something we want to kind of look at in the future. Thank you.
I would love, go ahead.
Marvin, going back to the same scenario you posted, again, unfortunately not an uncommon situation. So your position is here as a source. You are as a bystander, and again, there is a lot of power here. With you being the attending physician, hopefully senior physician in the room. One way you could address this is after the fact. When others have left the room, you can directly address this with the patient, and you can say. Something like this, as Dr. Johnson just mentioned, this has nothing to do with your care. Can you help me explain what has this to do with your care? My suggestion in this case would be to address it right away, because this happens way too often with our medical students and our residents and our attendings too. As bystander, we must take some action.
I do want to continue to ask the question to the panelists regarding the question about when a source responds and they have to reflect and get to the point where they need to respond to the recipient and bystander. What should they do? What should that process be like, as a source? Dr. Piamonte.
Oh, I think that it's human nature for our egos to become defensive in a situation like this. It is so difficult to acknowledge when we've made a misstep, especially when we don't think that we did and we thought we were giving a compliment, for instance. I think that Dr. McKillop's quote from Viktor Frankl about that space between when something happens and when you can respond is critical. And I would hope that the next time I'm called out on something, I take some time to reflect on it. And I remember that very important point that my intention matters less than the impact that my statement had. And I have to cultivate humility and say, I didn't mean it. And I don't think I did anything wrong. However, I affected this person in this way. I'm going to apologize for that. You would hope one would get to the point of like, I messed up. I get that my intention was even wrong. But even if we don't get there, and someone could say, I think my intentions were pure, but my impact was problematic, and at least apologizing for that is a step in the right direction.
Yeah, I agree with Nicole. Again, impact is more important than the intent. And many times the source has tendencies to say, defend themselves. I didn't mean this. If you're having a conversation with them, you have to just say, stop here.
Mhm.
Please try to understand the impact your statement has had on this student or a resident or attending.
Yes, absolutely.
Agreed. I loved the line in this paper, the triangle paper, that an apology should be about recognizing someone else's pain. And I think that folks in situations of privilege who are the source, we get caught up in our ego and we think, oh, but I'm a good person. That is irrelevant. That is irrelevant to the impact of what just happened. And it's not about us.
Mhm.
It's not about us as the source. It's about the lived experience of the recipient of this statement.
Mhm.
And reminding ourselves of that and working through that and making the apology not about us and our good intentions is critical.
Absolutely.
I notice a comment here from Bruce that he had to address student and resident experience with patient making racially insensitive remarks. Maybe we should have Bruce tell us what was the experience and how did he address? Bruce, would you be willing to share?
Could unmute and share if you feel.
Yeah, this I do a session with the students at the end of each 8-week clerkship block, and we call it like an ethics session, and occasionally students will bring up which they've had experience with a patient being making really discriminatory comments toward some of the residents or other students, and often this is at the end, so you can't do anything initially when it occurred, but there are a couple there's a really nice review or editorial from Annals a few years ago that kind of talks about this experience, and it's so hard. I mean, being a doctor is hard enough, let alone having to deal with all this other crap that gets thrown at you as well. So it's just something that as a white guy, we don't really experience all that much.
Thank you for sharing that, Bruce.
There's there's another message in the text from Amanda. What if the patient tells a provider that they're stupid, and this is a very difficult situation to handle, and I would say that ask for help. Maybe it depends again, if at that point you feel like you are in good emotional state to respond to the patient, but perhaps if that's not the case, maybe excuse yourself, come out and get some help. If you have your attending with you, you can explain the situation there. Anyone around you. First thing is to make sure you take good care of yourself. Many times when we are the recipient, it's tough for us.
Mhm.
And we don't want to ask for help. We don't even want to share this. It's embarrassing to even share with other people. But I ask you to, find the courage to share at least with somebody, and they may be able to help you.
Mhm.
I agree with you, Dr. Sharma. I think it's so important to take the time to see if you can respond in that situation. But I think this is where your team member, the bystander, comes into play, where they can definitely help and address the situation as well and clarify and tell the patient. So I think talking to your attending or other people around you at that time would be really important if you are not feeling up to at that point to address it as well.
And you can also state, if you don't feel like you're in a good position to help the patient, you can request not to be with that involved in the care of the patient, and that would be appropriate too.
Mhm. I would agree with that. And I think too, and I'm sorry if I'm pronouncing your name wrong, Rima, that point of later that day, you had someone come to teach the patient respect to nurses. So that's that emphasis on the bystander. So I'm not sure what that looked like for you when you had that person come in and teach them respect. But I think similarly to Amanda's point, you would hope that the person who does end up seeing that patient becomes your ally and your bystander and articulates the importance of your role. I do see your addendum here that what if this happened and the MD was also there and agreed that your role was stupid? That is egregious in my mind. I think that that is something I would take to HR personally. Okay, let me step back 1 minute. So we want to focus on reparations and restoration. So maybe I wouldn't go quite to HR just yet. Maybe I would try to facilitate a conversation or have someone else in the practice have a conversation too before I went to HR. I'm stepping back, I'm sorry. But I do think that if you don't get anywhere with reparations and rebuilding that relationship, maybe that's something I would take a more formal step in the organization.
I think this is also where the bystander can become the source as well, right? Because now you have two sources.
Yeah.
And if our focus is to repair, just like Dr. Piamonte saying, the relationship and reputation, I think, again, it's really important to also try to talk to the attending to say, hey, this is how I felt in this situation. And I would have loved your support, so I think having that conversation with the attending is going to be really important as well.
And Dr. Piamonte, I don't think your response is completely inappropriate in this situation, like go right to the HR. It depends on the recipient, right? What their relationship is to the MD and other folks around and how comfortable she feels. She may want to make an anonymous phone call to HR, and that would be appropriate. What is inappropriate is not to do anything and let it go, because way too many times we've done that. And one of the reasons why we are in a situation we are in is because we fail to speak up.
Yes, very important point. Thank you, Dr. Sharma. I like these comments in the chat.
Yeah, you guys are very courageous. Those who are, experiencing this, I tell you that you have the power. You have the power within you. Take your time, take good care of yourself, and think your thoughts through. Ask other people to assist you, but never be quiet.
So our hope is that we can't cover everything in this session, obviously, because microaggressions are things that are very complicated and dealing with those dynamics in the learning environment and in the work environment. So we hope that maybe we could extend these conversations and have additional sessions that would then maybe be dealing with race or gender, sexual orientation, and continue this dialogue So if you fill out the CE tracker evaluation and you have ideas for additional sessions or feedback for this one, please let us know what those are and we can continue this dialogue.
That's a really important point because we want to continue to do the inclusion series with different case scenarios. So we're really helpful if you can provide examples. And also we hope to bring in different panelists to be able to address different case scenarios as well. Dr. Sharma, go ahead.
Yeah, I was going to say the same thing. You guys are in real life. Give us the scenarios for discussion. We would like to make this a regular series. Every few months we get together and we talk about real life scenarios. I think that's the only way we are going to empower all of us.
Dr. McKellop, any thoughts, closing thoughts?
I think that we all have a responsibility to the lived experience of each other, and we can set our egos aside and become vulnerable. And I think this paper gives a really thoughtful, relational approach to rebuilding those relationships. And I encourage everyone to find the paper and give it a look.
Thank you. And I'm going to go back. Here is the title of the paper. So Microaggression Triangle Model. So if you Google that, you'll be able to find the paper, Humanistic Approach in Navigating Microaggression in Health Professional School. Excellent paper. And I hope we could continue to use this model at Creighton. Thank you.
Thank you so much.
Thank you for joining.
Everybody.
Thank you.
Heather has put the article. Oh, perfect.
Yeah.
So that's available. All right, great. You can sign off now. Thank you so much.
Thank you guys. Awesome job.
Thank you so much.
Thank you. Bye-bye.